So my name is Christophe Junot. I'm from France. I'm working at Paris-Saclay University and more precisely at CEA. And I'm head of a department that deals with medicines and healthcare technology. And I'm involved in the MicroPredict project at two levels. The first one deals with biomarker discovery. And also I'm heading the work package dedicated to biomarker validation and the design of point-of-care tests. We are now in the personalized medicine area. 30 years ago, every patient used to receive the same treatment, and it was to work the same way in everyone. And we know now that it is not the case. And we know now that we need to adapt the treatment to each patient. Metabolomics deals with the large-scale detection of all the small molecules that circulate into your body. And most of these molecules are still unknown, but they could be a source of new biomarkers. And so that's what is presented here. In the frame of the MicroPredict project, we want to improve the care of patients with chronic liver diseases, especially those who have some decompensated cirrhosis. And as you know, a large number of these patients will unfortunately die. So we have to know as soon as possible if the patient has a high risk of mortality within the months to come. And so we need to have biomarkers to predict the fate of the patient. And so that's what we did in the frame of the MicroPredict project. We analyzed a cohort named Mucosa Predict, 100 patients that were followed over a 3-month period with blood samples, urine samples, and also stool samples, because it is important to have as many biological compartments as possible to maximize the chance to find biomarkers. And here, it is an overview of the results. For the moment, most of the clinical biology is performed on blood samples because that's the most simple and because it is easy to normalize. But we discovered that we were able to detect more information, for example, in urine and in the feces compartment compared to the serum. You see the size. And we also discovered that there were some links between the metabolites detected from one compartment to the other, between the concentration of metabolites detected in serum and in stool, for example, or in serum and in urine and stool, okay? And so in these three compartments, we were able to distinguish patients with acute decompensation from those that are even worse, to say they have an acute decompensation of their cirrhosis with the acute and chronic liver failure syndrome, which is the most severe form of the cirrhosis decompensation. And so for the first time, we were able to find some specific biomarkers that could be used after validation as prognostic biomarkers. And here we demonstrate that the stool and also the urine compartment could be also an interesting source of alternative biomarkers. And some of them have already been validated in the frame of the MicroPredict project. Thank you very much.